guidance and some reminders. And then we are going to talk about laying the foundation for a successful school year. And then we will have questions and wrap up. But if we have time during this presentation, instead of waiting to the end, we might take some questions along the way. So next slide, please. These are all the NC Pre-K sites for this school year. We are so happy that you will be part of our NC Pre-K family here in Rowan County. And we applaud your commitment to the program and to the children and families who have chosen to be a part of your classroom community. Next slide, please. I hope Cynthia is ready. Are you ready, Cynthia? I'm going to turn it over to you.
Yes. Hi, everybody. I think I know pretty much everybody. My name is Cynthia Rodriguez, and I'm the NC Pre-K lead. So here are the forms, the information about the health assessment, dental, and immunization. Please make sure that all of them have the vision and hearing. Now, we don't have the appointments with the families, but when we receive it via email or we send notifications to families, we let them know that they have to have the vision and hearing, because if not, they will be considered as incompleted. Also, they have to be dated for within a year. So this year will be August 11, 2020, from August 11, 2020 and until now. We have some copies, but also we gave back the originals to the families so they can have them to turn them to you. But if you need a copy of the health assessment, dental, or short records, and to see if we have them, please send us an email with the name of the child and what are you missing from. Okay, next one, please. The NC Pre-K forms. Please remember those forms, you can find them on the website, and every time there is a teacher change or administrator change, you have to let us know as soon as possible. This is really important because we have to send all that information to the state. The state has to approve it, and then we can process payment and attendance and everything else. So if we don't have the information on time, that could jeopardize the payment for the entire county, because we can not pay them like one part and then pay the rest of them. We have to pay all of them at the same time. So please make sure that every time that you have a change in a teacher or administrator, just send that information to us as soon as possible. The child drop form is necessary because that way we know if you are dropping a child that we have to find a place, and we have to find a replacement soon. Right now, I don't know how the state is going to pay, if it's going to pay based on attendance or if it's going to pay like last year, regardless of the attendance. But if we need to find a replacement as soon as possible. So please send that form as soon as a child drops. The substitute sign sheet, that is if you have a substitute for the teacher or teacher assistant, we will need that form in case there is more than the 2 weeks that is allowed per the state. Okay, the parent contact form, parent involvement, all those forms are the same from last year. And the attendance, please make sure you send it to me in alphabetical order. I will send it back and I will request that you send it back to me, because every year that we get audited, it's easier for me to send all the information that the artists are requesting if we have all the information as we have it on the state, on the attendance, and every single form. So if for some reason it's not in alphabetical order by last name, I will send it back. Also, make sure that it's typed, and make sure that at the end, it has all the number of days that the child attended. The
Where do I
attendance
go to
will
type my name?
calculate it. The attendance will calculate it by itself. But if for some reason you're doing it in a different way, you will have to count the days that the child attended and add it at the end of the attendance. If not, whenever I send back the invoice and the reports, I will ask you to resend the attendance again. And the monthly statistical is a way for us to also do our quarterly reports. So please make sure that you complete those and send it to us with the attendance. And the attendance and monthly statistical are due at the last day of the month. Okay. Next one, please.
Cynthia, before
Yes.
you go on, this is Laura. I just wanted to let everybody know we had the statewide meeting yesterday, and they said at that meeting that the August through November would not be based on attendance. It would be like it was last year. This is to give counties time to recruit children, because we're finding that the recruitment and placement of children is going a bit slower than in previous years prior to COVID. And then December through June, it would be based on attendance. So that's an update about that. Cynthia wasn't able to be at that meeting yesterday. And then I just wanted to comment about the monthly statistical, because I'm the one that enters that data. I find a lot of times that sites, you guys will, not update us when a teacher has taken classes, or you'll say that the teacher is taking classes, but you haven't provided the supporting documents to show that they passed the class. That's stuff that we need to know based on our quarterly report. And so make sure you send, I'm getting a lot of feedback, I'm not sure why, but make sure that you send those documents that that the teacher has successfully completed the course, and to update us if you say that a child has been referred for like a developmental delay or a check for IEP or something like that. Please update us once they are receiving services. That's clearly written on that form. So just make sure you go back and update that for us when that happens. Thank you, Cynthia.
Thanks, Laura. Okay, so next one, please. Okay, so this year, everything was different with COVID, and we were not able to go directly to the sites to do the monitoring tool. And we found a lot of missing information. We found that a lot of the sites didn't have the information in one place. And I don't know why, because in the past, the first year that I did the monitoring visits, a lot of the sites will have a box like the one in the picture, and they will have every single information that is required from the monitoring tool in that place. So it was easier for me to just go and look for the STAR license, look for attendance, all the information that it was a requirement. It was just right there in that box. So we are just suggesting again to all of the sites to have just one place for all the documents. You have to have them in one place from the beginning of the school year in case that we have to monitor, or in case that the state requires something, that you just go to that place, find the document, send a copy. Because a lot of the information that we requested at the beginning of the monitoring visits, it was just incomplete. It was missing at least one piece from the whole monitoring box. So please make sure that you file all the documents, refer to the monitoring toolbox, just the monitoring tool document, and it will show you everything that you have to have in that box. Okay, next one, please. The print one. So another issue that we have with the monitoring was the compensation part. Please remember that that is something that the state requires us to verify that the teachers are paying on years of experience. And if they are not paid just with with the pay stub, they can also supplement it with the employee benefits. So that's why we require a copy of the pay stub and a copy of the benefits if the pay stub is not enough. And that is not something new. It has been like that for the last 5 years that I have been with Smart Start. So please make sure that whenever we require something, you have it on file because it's part of the monitoring tool and it is part of the monitoring process. Okay. Next one, please. Okay. So the monitoring policies. A lot of the sites didn't have the nutrition, the transportation fees, and the religious activities. They don't have an actual parent handbook just for NC Pre-K. So we are thinking or to have it like at some point in our local policies, to have a parent handbook just for NC Pre-K that it will have the nutrition part, the transportation phase, and the religious activities. And if you see at the policies and the tool, you have to have it somewhere. And we couldn't find it anywhere. So please make sure that you have or start developing an NC Pre-K policies that you can give them to parents. Like I said, we will have it at some point in our local policies, and we will let you know ahead of time. Okay. Next one, please. Okay, bus driving. This hasn't been an issue in a couple of years, but last year it was an issue with one of the sites. Please remember that bus driving is not allowed for any of the NC Pre-K teachers or any of the NC Pre-K teacher assistant at all. It doesn't matter if it's before the NC Pre-K day, after the NC Pre-K day, it doesn't matter if it is the last resort. Teachers and teacher assistants are not allowed to drive the bus at all. Okay, and if you have any questions, please send us an email, call us, because it wasn't an issue. And like I said, last year we found a couple. Okay, next one. What's new? Kathy, so now I turn it to Kathy.
Yeah, did you guys have any questions for Cynthia or anything? Did you see any in the chat box, Jamie?
I do have a question. Would you rather me put it in the chat or just ask?
Just
Just
ask.
that.
Okay, as far as the deadline for having dental and health in, has it gone back to 30 days this year?
As far as I know, yes. If for some reason we have a new date, I will let you know. But right now it's 30 days from the first day of school.
Okay.
Last year they keep it pushing it and pushing it. I don't know if they're going to do that this year.
And then I have a question about reporting attendance. Last year we ended with just the check mark system. Are we going back to different letters or what will we be using?
Right now, I think that it will be again just if the child is present or not. Like Laura said.
Until November.
Yes.
Okay. Through the
Yes.
entire month of November?
Yes.
Laura, that I don't know.
Yes. Yes.
Okay, thank you.
Yeah.
Yeah, that's my understanding.
And I will send the attendance to everyone. And like I said, it's also on our website.
All right, thank you so much.
You're welcome. Any other question?
There's none in the chat box that I see yet.
Okay. If not, we can just wait for at the end.
Yes. Okay, well, I'm going to go over what was new and what was shared with us yesterday during that meeting with NC Pre-K. So we now have the 2021-2022 interim COVID-19 policies for the NC Pre-K programs. I was trying to get my camera on, but it's not working. There I am. And I'm going to give you a summary of what they told me. I emailed that document to you this morning. So I was going to go over each little section with you and let you get a little idea of what we heard yesterday. So the purpose of the guidance is meant to address reopening expectations, and they're specific to the NC Pre-K program. It applies to all NC Pre-K classrooms, public schools, private sites, and Head Start programs. For the health and safety section, all the preschool programs are required to follow the health and safety guidance outlined in the Child Care Strong NC Public Health Toolkit. And Teresa Mallory will probably have some better information on that next after I get finished. The program year, the NC Pre-K program will operate for a full 36 weeks, 6.5 hours per day, 5 days per week, beginning no later than September the 7th. For classroom staff, the only guidance was about long-term substitutes. While the expectation from DCDEE is that all sites will work to secure qualified staff, they recognize that the impact of COVID-19 has had on this ability for programs to hire and or maintain qualified staff. Therefore, for the 2021-2022 program year, DCDEE is waiving the 12-week limitation for long-term substitutes. Okay, so this year, the mode of instruction is that all NC Pre-K students will be provided fully in-person instruction for the 2021-2022 program year. Circumstances when remote learning may be needed. The NC Pre-K programs will not be allowed to operate fully remote or hybrid. However, remote learning may be provided to children for a limited time in response to any of the following circumstances. During the weeks prior to starting instruction on September 7th, home visits and orientation may be done remotely. If a COVID-19 cluster occurs at an NC Pre-K site and they need to close temporarily for cleaning, you can do fully remote. If a child is not able to attend for an extended amount of days due to child and or household members being sick and or quarantined due to COVID-19, the Department of Health and Human Services issues a directive, if they issue a directive that requires closure and or reduce the capacity to minimize the spread of COVID-19. Those are the instances when you can use remote learning. So if any of these things happen, these are the remote learning requirements. NC Pre-K teachers should provide short, direct instruction and provide activities and learning opportunities for children and families that total approximately 6.5 hours of available material daily. Remote moments are blocks of live, direct, remote instruction delivered daily by lead teachers or teacher assistants. And teachers are required to plan and deliver 5 remote moments with different activities throughout the week. Offer remote moments once a day if it is being provided to an individual child or specific children. Offer remote moments twice per day if remote learning is being provided for all children. Offer remote moment materials to families based on the family needs. And what they really mean with that is that if a family needs help with downloading some of the apps or whatever that you use, then you could help them with that. You provide materials that are in the home language, and you can provide paper packets if the family does not have access to technology. Family engagement check-ins. You will need to do those again if for some reason you are remote. A check-in could take place through a call, a video conference, or through a socially distanced home visit. Lead teachers are required to prepare for and document every check-in in writing. Check-ins are counted as attendance. Offer at least one check-in per week if remote learning is being provided individually or to specific children. Offer 2 check-ins per week if remote learning is being provided to all children. Utilize the family check-in to provide updates on site responses to COVID-19, share ongoing information on their child's development, provide individualized activities, and encourage families to bring questions, concerns, ideas, and evidence of learning that has taken place at home. Encourage the child to be an active participant in the check-in. So that is all about the remote learning in the guidance. Teaching strategies resources. DCDEE is continuing to provide access to the teaching strategies distance learning resources, which includes access to the digital curriculum, remote access to professional development, assessment resources, family resources, and two-way communication through the family app. NC Pre-K teachers must use teaching strategies resources for remote learning. NC Pre-K teachers must conduct ongoing formative assessments. All NC Pre-K teachers are required to document child growth and development data in My Teaching Strategies Gold. And the plan is for that the data that you provide, they are going to share with the kindergarten teachers when that child goes to kindergarten. So Ready Rosie. NC Pre-K programs are required to enroll all NC Pre-K families in Ready Rosie and must incorporate Ready Rosie resources into their family engagement plans. Professional development. Teaching strategies will continue to provide professional development sessions for NC Pre-K teachers, teacher assistants, and site administrators throughout the school year. Teachers and teacher assistants will be required to complete 3 training sessions. A schedule for these trainings will be developed and shared in the coming weeks. Another offering of the training, Getting Started, A Day in the Life of Creative Curriculum Classroom, is scheduled to run from August 5th through August 20th. This training is for new NC Pre-K teachers and teacher assistants, and anyone who did not attend that class or that session last year. So right now, when you go to sign up for that, it may say that they're sold out, but they are supposed to add some new sessions and some new slots to those sessions. So they will email me and may email you when they get that set up. Payment policy, and Laura talked about this a little bit. For the months of August through November, it'll be just like last year. DCDEE will provide classroom payments based on the assigned teacher rate and the number of slots allocated. For the months of December through June, DCDEE will provide payments based on the traditional per child attendance-based model. COVID-19 attendance exceptions. Per child reimbursement rates will not be reduced if a class is closed due to COVID-19, a child is unable to attend due to the child being sick and or quarantined due to COVID-19. NC Pre-K programs must communicate with their contracting agency to request a COVID-19 attendance exception. So that is the information that I had to share with you. So any questions?
So that training that you were just talking about, if we took all the trainings last year, we don't need to take this new one, this first
No,
one?
you do not. Not the one that's in August this month. If you took all three of the ones last year, you do not have to take this one.
Okay, I got an email and I've already registered for it. So I just need to deregister.
Yeah, just
Okay.
cancel it. Yeah. Okay, so
We do
I would
have one
like,
question in the chat, Kathy.
oh, okay.
Someone asked, can these trainings be centered around teacher work days?
They were, these are scheduled by DCDEE and Teaching Strategies. And I have no way of saying or giving them any feedback unless they ask me for it. And they did last year. So they may again this year, they may be already going by some of the calendars for the school year. You got to remember that this is for the whole state. So, you know, you got to take them when we can get them. So, but we will try, and I will give that feedback to them. So.
Okay, and Kathy, this is Denise. I did not take any trainings last year because I was Cabarrus County, and I do not recall receiving a email from anyone to take the trainings.
Okay, there should be. Last year they did. I thought, Sandy, where are you? Sandy, did
I'm right here. I was getting ready to text you, Denise, and let you know the trainings that you did last year with Teaching Strategies. There were 3 of them. You did that. You did do those trainings, even though it was for Cabarrus. It was really for the whole state. So all of that, yeah. So all of that's the same.
Okay, thank you.
Uh-huh.
I know you have a little different situation down there at McKnight, so I didn't know, but I knew that all the teachers had taken the training.
Kathy, I have a question.
Sure.
This is Michelle. On the revised guidance for the NC Pre-K reopening, on page 2, it talks about the new flexibility for 2021-22. Could you maybe reiterate what that means, where it says the North Carolina contracting agency will not be required to assign a lower per child rate for classrooms who must hire long-term substitute lead teachers? Does that mean that if a long-term substitute teacher is assigned to the classroom, that they will not be the children will not be at the $550 rate?
That is how I understood it. Laura, is that how you understood? I know Cynthia couldn't be there, but I understood it that they would pay according to the teacher that had been assigned for that classroom.
I think so. I don't know. I don't remember, Kathy, because I don't know if they've sent us those today because I've been busy working on children's apps. So, but Michelle, that's my understanding as well. I don't know if there's a time limit on that. Of course, they really don't want you all to go beyond that
Right.
time frame, but they will extend that too, as Kathy mentioned before. So that's our understanding, but we will really rely on Cynthia to read through those guidelines once she gets back from her vacation and make sure she understands, and then she can clarify with folks.
Okay, thank you.
And I know that the substitutes, it says that the 12 weeks is going to be extended, but they really, really want you to get somebody in that classroom. And they didn't give us a timeline, like they were going to let it go for 16 weeks or whatever, but they did say that they were going to extend that time till you found somebody, I guess. So, any other questions?
Kathy, we have one more. Someone wants to know
Okay.
if there's a way that they can get a copy of their certificate if they've already taken the training.
That again is a DCDEE and a Teaching Strategies question. And I will check to find out who we need to talk to about that, and I will send that information out to you. So we are talking about certificates for those trainings that was offered by Teaching Strategies, right?
Yeah,
gonna make a
Cassandra,
note
do
of
you
that.
want to just clarify if that's the exact training that you're talking about?
Yes, that's the training.
Okay, okay. I will check and see.
Kathy,
Yes,
and when you come out, are you going to be looking for training certificates? And the reason I'm asking is I have 4 staff members that went on, and obviously it was full. And 2 of them are brand new. And I don't want them to start until they've had this. And some of them, the times are after we start. So I had said, one will sign in, the one that was able to get in, and we'll just have it in a room all together, and you can do it all together. But they obviously wouldn't all get a certificate. Only one would get a certificate. So I guess for monitoring, do we just need to wait?
I would recommend waiting, Norma, so that there's evidence, since this is a state requirement that they do this.
and even last year when they were offering these trainings, and it'll be the same this year, they will go on after the school year starts. So I would,
Okay.
yeah,
Thanks.
I wouldn't
That's a
worry. And
shame, though.
I'm not
But
looking
thank you.
for, yeah, I'm not looking for any certificates when I come. So that would be something that DCDE would probably look for. But all
Well, if
right,
it's a requirement, Kathy, from the state, if it's a new requirement that the state has put out, it would be something that we would look for evidence for and adjust our monitoring report if needed.
okay, okay. All right, so now I think we're ready for Teresa. Teresa, are you ready?
Yeah. Yes. Can you hear me?
I can hear you.
Okay, great. Not on my system, so I'm not sure they're working on mine. Hello, everybody. I work with a lot of you, but I'm the child care health consultant for Rowan County. And the guidance, as you know, Governor Cooper allowed the mask mandate to end at the end of July. And the guidance was updated last Friday, and it's been updated again. We're having a meeting tomorrow, so I will be in touch with an email to let you know the outcome of those. But the state is asking that childcare provide a safe environment by layering different strategies that have been effective. And they've divided those up now into 3 categories. You have required, you have recommends or should be implemented, and ones you should consider. The should be implemented does come with the notation that the NCDHHS strongly advises that child care programs adopt all the strategies in this section. And I believe I heard you say that NC Pre-K is going to have to follow all the guidance in this toolkit. So basically the required guidance is everything you did before COVID, following the child care rules, sanitation rules, and so forth. The rest of it, more or less will fall under the should category, with the exception that it is required if the health department should order quarantine, you know, something to do with COVID through the health department, you would be required to follow that guidance. But the rest of it is falling under should, and that's where I think a lot of you may have questions, because as parents read the toolkit or listen to others, masks come under should, but I think that the DHHS is expecting they will. So in the toolkit is you should require all adults and children above the age of 2, regardless of vaccination status, wear a face covering at all times when indoors, unless you have an exception applies, which there's a list of them on page 6, or the person is eating or sleeping. They also recommend the 6-foot distancing if possible. We know with younger children, sometimes that's not possible. and for you to maintain your classrooms with no mixing or interaction between groups or cohorts if at all possible. The one thing they have highlighted as should would be to require the staff to report their vaccination status and require unvaccinated or those who do not disclose vaccine status to be tested weekly. So that is new in the toolkit. And if anybody has any questions, let me know. So they have,
Teresa,
I'm
sorry, I'm not clear. Okay. Is
Okay.
should considered required or recommended?
Yeah, that's what we were talking about in our meeting this past Monday. It is listed as you should do this. It is not under the required, but at the same time, they're also telling you that they strongly advise that child care programs adopt all the strategies in this section, and they go further to point out that failing to do so, you're creating an increased risk. So it's almost like they're not telling you have to, but at the same time they are, because they have in bold homepage for strongly advises that child care programs adopt all these strategies. So those are some of the things we're going to talk about tomorrow, because that was in our CCHC meeting Monday. They were telling us that even though it should be implemented with that addition, they add these strategies, if not implemented, create conditions of high risk for COVID-19 exposure and spread. And they also, brought up monitoring the cluster list and that kind of thing. So that they more or less left it up to you, but it's kind of like you really need to do this. And because they have put that terminology in there, then the issue could become, if you had a child that became ill and something should happen, you've got a possible liability issue there, because they've told you that you really should, even though they're not telling you to have to. And I've already had some talk about, the parents read these things and they're going to come back to us and saying it's not required. So because of this, it was discussed Monday that we're probably all going to have to develop COVID policies. And we have asked if the resource center would probably do that, give us some type of a sample policy we could work off of. So we're waiting to hear back, hoping to get more information on that tomorrow. So yes, the should, which is a lot of the control of COVID, that's where it lands, is under should. And then the third category is should consider. So those, you may get by with not putting those in, but the required and the should, you probably need to plan on putting those into place, as the information that we had received Monday. So basically, in the new guidance, the required is dealing with what you're used to, what you had to do before COVID, following, the child care rules, sanitation rules, and so forth. It does mention the health department with COVID, if contact tracing, or I should say you've got to quarantine. So right now, the health department is at 10 days on quarantine. You can choose to be 14 if you choose for your facility. And that's something that would be discussed when we start looking at a policy. but they are currently at 10 days.
We have
You
a
do
couple of
follow the-
questions, Teresa, just so you know
Okay,
we're ready.
okay. Go ahead.
All right, so first one is it a requirement for the NC pre-K teachers to wear masks?
That right now is one of the should, is that everyone indoors should wear a mask, regardless of vaccination status. And that's coming from the CDC guidance because of the Delta variant and its ease. You can get it even easier than we got the original. And I know Mecklenburg's around 77% Delta, and I think we're right there at it. So they had said the initial variant, they would anticipate you would infect maybe 3 to 4 people. With Delta, they're saying it's probably closer to 9. It's extremely contagious. And because of that, they are asking everyone indoors to wear their mask. And I think, I know that's probably going to be where you get some pushback from some people. But that is the should recommendation, regardless. And partially also because we are seeing breakthroughs. If you have been vaccinated in the past, people are getting COVID again. Hopefully, from what we're seeing, you may be really sick, but not necessarily hospital ventilator sick. But people who have been vaccinated, I would say those that were vaccinated back in January, we're seeing a little bit more of those according to contact tracing. So because of that, yes, they do want you to wear a mask in the classroom. It is
All right, the next
recommended.
question is, sorry, if the staff is being tested weekly, can they not be in the classroom until their test results come back?
If they are doing the screening weekly, it's my understanding that as long as they are symptom-free, that they should be able to wear their mask and continue. And then if they should get a positive at that point, you would have to address the classroom and the staff. If they have symptoms, if they've had an exposure, they should be anticipating watching for symptoms. And if they should have symptoms, they may want to get tested, and just, to make sure, because what we are hearing as more than what we had before, we used to have a lot of asymptomatic. Contact tracing said that everyone seems to be having symptoms with this. So they should be able, if they're doing weekly screenings, wear their mask, and as long as they're symptom-free, continue, and then if it should turn up positive at that point, we'd have to address it right then. But there'd be no reason. I mean, if they're going to have to do it weekly, it would be almost like how they did the nurses back with long-term care when this first started. So the other thing is, and that was in there, to report that status. Just to give you a little bit more information, right now the current count in Rowan County is 465 active cases, and it's increasing rapidly. Where our percent of people who tested positive was down at one point to 6.1. It just today, they had given us an update, and it's now 13.7% of the people that are testing are positive. And the majority of the cases are between 25 and 49-year-olds and 50 to 64-year-olds. And that 25 to 49, those groups are the lowest in vaccinations. And our 60% of the recent deaths were from people who had underlying conditions, and most of those are not vaccinated. So, you know, they would like for us to encourage vaccines, let people, you know, if they have any questions, there's lots of information. You can reach out to me if somebody has a question. And we can certainly, you know, provide them information that may, if they're on the fence about whether they want to take it or not. And still have antibodies. I see that question, to protect you, do you have to wear a mask? Yes, because everyone, regardless of vaccination status, is going to have to wear the mask, because apparently we are having breakthroughs where people who have been vaccinated are getting it again, and they're pretty sick, but they, you know, generally they're not having to go to the hospital. So because of that, because of all the breakthroughs, everyone is asked to wear the mask in the classroom.
We have
when
a
they get
couple more
outside.
questions. We actually have a bunch of questions, Teresa. I want to try to get
Okay.
them all.
Okay.
Let me see. We have, can you repeat what the focus is of your meeting tomorrow? That's one question. Oh, okay. And then this one was first. You said if it was just said, so you just said the NC Pre-K needs to follow everything in the toolkit, please verify what you mean by all.
Well, that's what I was asking Kathy on that, because I think they were going to use the toolkit as their policy. And if you use the entire toolkit, then at that point, you would also be looking at the section that they deem should consider. You know, the first two really should be done. But then the should consider part would be the only thing that I see that we have any leeway with. And those are things like developing plans or procedures that maintain prevention strategies, but allow family and staff to meet for orientation to the program. They said maybe you might would have to do some virtuals, or separating children's nap time mats and cribs and placing them so that children are spaced out as much as possible, head to toe sleeping. Face coverings, you know, are not to be worn while they're napping because of a suffocation risk. But there's things like that that it says the program should consider. So if we're creating a policy, that's a section we'll be able to look at. But if you, in your policy says you're going to follow all the guidelines in the toolkit, then you will have to follow all those guidelines as well, because whatever the policy is what licensing will be looking at to see if we're following. So after we had some issues and concerns. I think licensing had some, and so there is a meeting with myself and licensing, people in Raleigh and Christy from DHHS. We're all meeting tomorrow to discuss some of our issues and concerns, to see their take on it and what they're expecting exactly from us from this toolkit. But after my meeting Monday, it was, we're going to have to develop COVID policies probably for every center. So we're asking input, and I'll know more after my meeting tomorrow.
And as far as the guidance that they gave us, it just said that all preschool programs are required to follow the health and safety guidance outlined in the toolkit. But I believe what they were really saying is that if you are housed in a school system or anywhere you are, you have to follow the Child Care Strong public health toolkit. You may have to follow other things when you're out like if you're out in the hall or in the cafeteria or that sort of thing, you may have to follow what the school system says. But they want you in that classroom to follow that childcare toolkit.
And that's what I understand, because the NC pre-Ks that are housed under the school system, I know the school nurses will have guidance that they'll be getting from Sharon. And Sharon and we talked briefly today, we'll talk again, but so they will have an in-house nurse that they will be getting additional guidance through the school system to go along with that. But she did say, you know, that they're basically going to have to follow the guidelines in the toolkit. So that the should consider things would be an option. It's not saying they strongly recommend that you do those should consider. But the required and the should implement, you know, the shoulds that the other shoulds, I guess I should say, those really are going to have to be addressed as well. They're pretty much, it's going to be something that you're going to want to do, since the DHS is strongly recommending it, and implying otherwise you're setting up a risky environment.
So we have a few more questions. Do you still have more content to cover? Am I going to need to send you these questions, or are you okay with answering the rest of these?
I'm okay. The only other thing I was just going to mention to people was the fact that we are seeing symptoms with most of these. We're not seeing the asymptomatic like we did before. And you've got the 5 that everybody's familiar with the fever, chills, shortness of breath, new cough, and loss of taste or smell. But they were also adding to that if you see these, sore throat, diarrhea, nausea, vomiting, and a new onset of a headache, especially with a fever, that person needs to be tested, because those are also being seen as symptoms with the Delta and what we're seeing now. Okay, that's all. I was just going to point out symptoms to make sure everyone was aware of what we're seeing come in.
Okay, so next question is, if your job already has a system in place where staff are getting tested every 2 weeks, do they now have to do it weekly?
I will ask that. I know that's a should, and it is being recommended weekly. But if they have a system in place where they're doing it every 2 weeks and have been consistently doing that now, I would think that would be okay. And that's what you would want to put in your policy when we get to the point of developing a policy on this. But I will certainly clarify it in tomorrow's meeting. But I would think you've got to screen yourself every day before you come in. If you have any of those symptoms, you should not report to work. So I would think that if you're screening yourself every day and you're asymptomatic and you're getting tested every other week, I would think that would be acceptable. But I will certainly clarify that.
Next question is, are we still taking and recording temperatures?
Well, the American Academy of Pediatrics in their health check says at least get a temperature. And what we had initially been told, because all of us understood that in the beginning we had to take temperatures, but they always said that it was recommended. But at the same time, they said we have been doing this and then we stopped. We may be asked to explain why we stopped. So at this point, we are seeing fevers more, you know, my recommendation would be to try to continue doing the temperatures, and because contact tracing says that they are seeing more fevers with this. But whatever you decide to do, if you don't include that as part of your screening, and you had been doing that, then it might be something at some point you would, you know, have to explain why you stopped. But right now, with temperatures showing up, I just think it's a safe thing to do. And then remember, we keep our screening records for 30 days. And we still have to screen in the morning, by the way, even though in the new toolkit, it was noted there's no screening tool on the back of it anymore. And so they were like, where is that at? We got to get that back, because people would think they didn't have to do that, and they still want that done. Well, I noticed in the update that came out August 2nd, it's still not attached, but it is still something we need to do. And if anyone doesn't have that form on hand, let me know.
Teresa,
Uh-huh.
is there an updated flyer that says the symptoms that you just named, like the diarrhea and the headache and stuff, so that we can like post a new sign? I saw on the DCD website, it just has the toolkit available. It doesn't have the forms like we've had before.
Right. And I don't know that they've changed that yet to show that. But on page 10 of the guidance, it outlines those symptoms. And it, as always, it goes on to tell you it does not include all possible COVID symptoms. And there is a link in there that will take you over to CDC that shows different symptoms.
Thank you.
You're welcome.
All right, guys, we have a couple more questions, but what I'll do is I saved the questions from the chat box. I'm going to email these to Teresa, and obviously after this meeting tomorrow, she'll probably be able to answer them more clearly, especially if anything changes tomorrow. So if you didn't get your question answered, since we have to move on, we will send answers in a follow-up email. If we did not get to your question, it will not be ignored. It may be possibly Monday before we're able to send these to you, but we will send them to everybody. I'll put the question and then her answer under it. Just give us a little time to get it done and get it out to you. Thank you, Teresa.
Oh, thank you. You're welcome. And always the ones, a lot of you know how to reach me. You can also call me if you have any other questions, but hopefully after tomorrow, we'll be a little bit more clear on what they're expecting from us.
Thank you so much. I really appreciate it.
You're welcome.
All right, so Carolyn, are you out there?
I'm out here.
You're not?
I'm trying to see. I can't, for some reason, my picture's not coming up. So, but you can hear me, right?
We can.
Okay. All right. Hi, everybody. Good afternoon. Thanks, Teresa. Now that we are really confused, and I want you to know that we're all right there with you. And Teresa had mentioned that she has a meeting tomorrow with Christy Snuggs, who is our Deputy Director with DCDEE. An email was also sent out to all of you yesterday that they will be having a panel discussion concerning the new health and safety guidance, and that will be tomorrow, 12 to 1. So I really hope that you'll be able to sit in on that. I know I will be, and probably every other child care consultant will be, because we want to make sure we're clear as we are trying to support all of you. So that panel discussion again is tomorrow, 12 to 1. An email went out with a link Now, if you did not receive it for whatever reason, if you want to shoot me an email, I'll gladly forward that to you. So you have that link so you can hop on that tomorrow afternoon. I also wanted to, Kathy, someone had a question about the flexibility of the health assessments for the children. I just wanted to address that real quick. And on March 1st, 2021, they sent out the new revised flexibility, and that was one that has been lifted. So the children's health assessments and immunizations need to be in within 30 days. Prior to March 1st, during the COVID-19, you had that 60-day window. Effective March 1st, that's no longer a flexibility. So you want to make sure that your families are getting their immunizations and health assessments to you within that 30-day window. Let's see. What else I also wanted to share is during COVID-19 in this past school year, most of you had a chance to see me, but it was a very quick visit. The reason behind that was we, of course, we're following the health and safety guidance and limiting the time that we spend in your facilities and your classrooms. We are now able, effective July 1st, to be able to spend more time in the classrooms. Of course, we're going to be practicing the health and safety guidance that you'll have in place. And as a state employee, I will continue to wear my mask at all time while I'm in your program. And I will be going back to typing my visit summary at the site. That's something we were not doing last year. So I'll probably ask if there's a certain spot where I can be, where I'm not interrupting you in the classroom, or maybe there's an empty classroom where I can go and type up the visit summary. Now, this past year, it was only the very shortened annual compliance visit that we were doing. Effective July 1st, we are going back to, of course, doing our annual compliance visit, and that's when we're monitoring everything. That's a full compliance visit. We will now go back to doing our routine unannounced visits as well. And normally when I try to do those within 6 months after the annual compliance visit. So hopefully you all, at least for me, hopefully, you'll be seeing me at least twice during the school year. Routine unannounced, we're not monitoring everything like we do with the annual compliance, but we just pop in, maybe check, see how things are going. Of course, check for group size, ratio, supervision, all that good stuff. Staff and training worksheets. I just want to remind all of you to go ahead and make sure that they are updated. And if your visit's coming up, you want to make sure you get those sent to me. As of right now, we are going to continue to have the administrators or the NC pre-K teachers complete the children's records form. So they are not wanting us to go through the children's files, again, to limit our time that we're there, but we will request that you do that. And just like we did this past year, we pull children's names and you're the one who monitor the files. So right now we're still continuing to do that. I'm looking at my checklist, see what else I had on here. Oh, the NC Pre-K, Kathy was talking about the monitoring tool. And that monitoring tool that Kathy was talking about, and the one that you complete every year, and the one that Kathy monitors, they are all based on childcare rules. And those childcare rules are in section 3000 in our childcare rule book. So those that are in that monitoring tool are also things that I monitor when I come out to your facility in the NC Pre-K classroom. So I just wanted all of you to be aware of that. And I wanted to let you know that that section 3000 can be found on page 182 in our childcare rule book. So that way, if you wanted to reference it or review it with your staff, so that way when they see me come in, they know what I might be needing to see. For example, their ongoing assessments that they're doing, what screening tool are they using? What curriculum are they using? What parent involvement that are they have they implemented? So they're the same kind of questions that are in that monitoring tool. And with the monitoring tool, that is also something that I'll ask to see. This past year, because it's been a crazy year, a lot of times they weren't completed, and that was fine because this was definitely an exception to the rule. But this go around, I'll be asking to see the monitoring tool as well as all the other things that are included in section 3000. Kathy mentioned too about the teachers. You know, you want to make sure that the teachers that you have in the classroom are the teachers that you have listed in the NC Pre-K plan. Anytime that I come out to do a visit that has a NC Pre-K classroom, one of the things I do even before the visit is I monitor the plan and to see who the staff are and to make sure that the staff that are in that classroom are actually the staff that are in the plan. So basically everything that's Kathy's telling you to do is that monitoring tool are going to be the things that I'll be monitoring when I'm out there as well. Trying to think what else. Again, with this health and safety guidance, right now it's, you know, it's a lot of gray area, and I feel it too. And I just hope that all of you are able to sit in on that panel discussion tomorrow, and hopefully we can get some clarification as far as how and what we're supposed to do this coming school year. I think that's all I had on my checklist, unless someone has any questions for me.
Carolyn, I did put the link to the meeting tomorrow, the panel thing, in the chat box. So they do have that link if they didn't get the email or if they lost it. And we do also have one question. It is, can students use other items in the classroom that others have touched, like Play-Doh, glue, scissors, crayons, water play, sand, etc.?
They can. That piece has been taken out of the health and safety guidance. It actually was taken out in the one that came out in June. So you are able to use the sensory materials again, but please make sure you're being diligent about cleaning and sanitizing. And I know Teresa will probably feel the same way too, because Rowan is a red county now. It's something that I would encourage you, and I'm sure Teresa would too, that you might still want to do it as an individual type of play because of how high we are right now in Rowan County. All the other materials that were limited in the other health and safety tool guidance kits, they've all been lifted. So with that said, please just make sure that you and your staff are being diligent about cleaning and sanitizing the materials in the classroom.
So Megan just asked about dress up clothes and soft toys and stuffed animals. So I think you just answered that.
Yeah, just make sure you're washing them. Anytime you see a child that might have put it in their mouth or might have wiped their nose on it or any type of bodily fluid, take it out and get it washed.
Do you need to wash these items daily?
In the health and safety tool guidance, they're not giving you any guidance as to what to do, but I would encourage that.
And I would agree with Carolyn because we are seeing more children with this Delta variant. So being diligent with hand washing, your sanitizing and cleaning is going to be very necessary during dealing with this. While it's increasing, we're on a rapid rise. And so I would do all of my cleaning, and I would do anything that child's going to be touching, especially putting to the mouth and so forth. I would clean those daily.
Thank you, guys. That's it for questions, unless anybody else has any.
Jamie?
Yes.
Teresa, will you mention to this group about we talked about at the collaboration meeting about the sanitizer and the disinfection.
Yes, to touch and revisit that issue. I know at one point we were using the 1,000 parts per million for COVID. And we need to return to the 50 to 200 and the 5 to 800, what we normally used for sanitizing. If you should have someone suspected of COVID or has been diagnosed with COVID in the classroom, then it's fine to mix up the 1,000 parts at that point. Do your sanitizing in the room and then get rid of it. We just don't want it mixed up with what you would normally use. But 1,000 parts is just too strong to be using, to disinfect tables and things around the children. You'd want to do that once the children had left the center. And then you would do your cleaning, open windows if you have them, let it air out, and then get rid of the 1,000 parts. You just don't want to keep it hanging around in the classroom. And we clarified that because I think we had some that were still using the 1,000 parts for their around the kids and changing tables or whatever, and can't do that.
Okay, so no more questions, Jamie? Nope.
No.
Okay. I think before I get started, Laura wanted to share some things with you guys. So Laura, are you?
Kathy?
Yeah.
Yes, really, I just want to do just one reminder because Cynthia went over the others regarding if you do have, I did send out that email asking you all to try to collect things from families prior to contacting us. It may seem like it's a simple thing for us to just make a copy and get it to you, but when we're talking about, over 300 applications, and then they're sorted into facilities, and then we'd have to go back and pull them out, and that sort of stuff. It does make it difficult. So do try to collect those first. We are a small staff, really, just Cynthia and I right now, processing pre-K stuff because Kathy's devoted to classrooms with pre-K. And then the only other reminder, since I do child placements, I'm in a lull right now, meaning that Cynthia is on vacation for 2 weeks, and Addie, who had been helping me, has been sick for the last 3 days. So that just leaves me, and so I am trying to get through. Amy even volunteered to help get through processing some of these applications so that we can try to get you full. So remember, just the key piece is that don't tell families, please, if you think that you have an opening or if you know that you have an opening, because remember, I manage that waiting list and you all aren't quite aware when I'm making offers to children or who's on the list or how many children. And they can't just come in because there may be other children in front of them. At this point, they're placed on the waiting list by the date that their application came in. So that would just be very helpful if you guys would be mindful of that. And otherwise, I hope the new way that I'm doing rosters is working for you guys, where you can just log in and see the roster as I make changes. So I don't know if you may just be logging in once a day to see if there's changes, but I'm hoping that that's working well. And then I'm looking at new ways to try to streamline other processes to make things easier for all of us. So are there any questions for me specifically?
Yeah, this is probably a question for you. The question is, what do we need to do with families that are not responding when they try to contact them?
So, go to the alternate contact if you have one listed there. Try email. If you, I would give it a little bit of time. You can always reach out to me, and I can also try to make a call. Usually when we get to that point where you have been unsuccessful, and if I make an attempt to call, then typically I will give them a deadline, 24 hours to respond, or, the site has the option to drop you, something like that. We have to be mindful a bit, especially when we go back to paying based on attendance. because you're going to want to keep children in your classroom. And I'm working, diligently over here to try to get you all full. So it's kind of up to you. You can reach out to me, see if I have any alternate numbers. I can't remember if your spreadsheet contains an emergency number. We do ask for that on the application. So if it's not on your roster, you can contact me and ask. Anything else?
I don't see any more questions right now.
Perfect. Thanks, Jamie. Thanks, Kathy.
No problem. So now it's my turn. I get to share some information for the new year. And I called this laying the foundation for a successful year because ready or not, here they come. And hopefully it's going to be an all in-person good year. But laying the foundation for a successful year is all about planning and preparation. I know the beginning of the school year can be overwhelming for teachers who have been doing it for many years and for brand new teachers. My hope is that you'll find a new idea or maybe remember something that you might like to try again during this part of the presentation. Every year we get a new group, and something we have tried in the past may not work with that new group. But the information and ideas that I'm going to share with you will always work. The children you are getting this year are coming from a very different place than any group that you've ever had in the past. This year, the children and families have lived through 18 months of a pandemic and civil unrest. And that can only equal trauma for everyone. So we need to be very mindful of anxieties and the resistance to engage with others. Hopefully we can reflect on lessons learned during all these uncertainties and make our classrooms a community of healing and kindness and a place to feel safe. This year, if you prepare the environment and build those relationships with your students and families and plan to teach those all important social skills, it will pay off greatly. Next slide, please. I love that picture. I'm not sure what the arrow is pointing at, but maybe it's the one clean spot in the room. First, we will talk about preparing the environment. If you take the time to lay the foundation now in the beginning, it will only make your life easier as your year progresses. Take time to create an environment that influences learning, behavior, confidence, responsibility, and a sense of community. The environment should say yes. There should not be anything that cannot be touched, manipulated, or explored. It should say you belong here and we are happy that you are here. Take time to label your centers and make visuals for expectations, rules, routines, and social interactions. You will not be sorry if you make those visuals. I'm not saying that you should have them on the first day of school, but if you get those in there, get those visuals up as soon as you can, you are not going to be wasting your time. So next slide, please. I am very big on using visuals in the classroom. They helped me so much during my last few years as an NC Pre-K teacher. We always have inclusive classrooms, and visuals, pictures communicate to everyone, to all children. The number one visual in your classroom is the daily schedule. Make your schedule interactive so that children can make the connection to the sequence of the day. The schedule is not about time. It is about the sequence of events. You can change the amount of time, but try not to change the sequence of the day. Circle time schedule. This always helped me with one or two who did not want to participate in circle time or had trouble with bothering others who were trying to participate in circle time. I would show my schedule and say, first, we're going to sing our hello song. Then we will do music and movement, and next we will read our book for today. Then we will all play a game. And usually my games were the transitions to the next activity so that only one or two children were moving at the same time to go wash hands or to line up for outside. As we finished each part of the schedule, I would remind them of what was next and what comes after that. Okay, we finished our song. Now we're going to do the tootie-ta. And after that, we'll sit back down to read our story. Use Velcro and have pictures for all the different things that you might do at your group time. The children know what to expect and they like the predictability. Most of you have a really good cleanup routine, but having the steps posted will definitely help in the beginning, and you can always refer back to them when you're trying to support a child. One tip that I would like to share is when cleaning up, try not to make demands like, Bobby, you need to pick those blocks up. You were the one who played with them, and you're the one who needs to put them back. You're only asking for a fight then. So state what needs to be done. So you're going to say instead, there are blocks on the floor. Where should they be? Or, oh, I see a puppet in the chair. Where does it belong? You're not telling anyone to do it. You are just saying what needs to be done. You're telling the story of what's going on in your classroom. And the story is like, I see Abby putting the crayons in the box. I see Billy taking care of our puzzles and putting them back where they belong. You will get more cooperation, and even the child who is not wanting to clean up will eventually want to be part of that story of your classroom. Next slide, please. Routines. It was always hard for me when I went back at the beginning of the year because I remembered the 5-year-olds that I had at the end of the last school year. And the new kids just seemed like babies to me. For most of the children coming to your classroom, they have no idea of how to sit for group time, how to get in a line, how to move as a group, how to eat at school, wash their hands, wait for a turn, or even remember to wipe their own bottoms. So having visuals for the routines in your day gives children the independence that they want. So at meal times, you want to show them the steps that they follow for the mealtime. When I was a teacher, my visual was sit, eat, toss, bathroom. You will make visuals with the most important steps, and everybody's will be different. If you're eating in the cafeteria, then your steps will be different from somebody else's. The restroom, my visual had a picture of pants with an arrow pointing down, so they would remember to put their pants down. A picture of the toilet for use the toilet. I had a picture of the toilet paper with the word wipe on there just to remind them to wipe. Then pants with the arrow up, and a picture of the toilet handle for flush. And you already have that hand washing picture at your sink. So next slide, please. Expectations and rules. I want to share how I view expectations versus rules. Expectations are very general and include everyone who comes into your building. For example, everyone needs to be safe. Everyone needs to be kind. Everyone needs to be respectful. Those are the expectations. Then the children will help you with making rules for the classroom. How can we be safe in the classroom? How do we be kind to each other? How do we show respect for our classroom? And you would do the same to make rules for the playground, for the cafeteria, for the hallway, for circle time, wherever you feel like you need those rules, you could make some rules for that area. Next slide, please. The centers. Have visuals for how to play in the centers. You can have steps for a child that wants to paint. You can have a visual for taking care of the books, the CD player, musical instruments. In dramatic play, you can have pictures of children dressing up, cooking, taking care of the babies. Some of your new children may not know how to play with the toys that you have available. In blocks, you can have pictures of children using different kinds of blocks and building bridges and roads and ramps and castles. So, next slide, please. Drills. Have visuals for your drills, fire, tornado, lockdown, and teach and prepare children before they happen if possible. Talk about the why we practice. Talk about if there will be a loud noise or if someone is going to make an announcement over the loudspeaker. Teach how important it is to follow the rules in order to stay safe. You may want to make a classroom book that says, you know, our book of safety drills that would have all your different safety drills in it. Teachers never get tired of telling children what to do. The children feel confident when they're able to follow the steps and accomplish a task. Next slide, please. Okay. Each year is a time to reset, to create an environment so that children can see themselves, their names, their pictures, their families, their culture, their interests, and you are also part of that classroom community. So include pictures of yourself, your family, your pets, your interests. I suggest that you add a picture of you when you were 4 or 5 years old. The children will love seeing you as a young child, but also use it as a reminder of what you would have wanted your classroom or preschool experience to be. Look at your environment and ask whose needs are being met. Is this classroom inviting, nurturing, comfortable, happy? Does it feel safe? Is the environment too busy or overwhelming? Create a place that children can explore, discover, and interact, a place they want to be. As a teacher, I tried to create that storybook classroom. I had beautiful posters and bulletin boards, and mostly it was because I wanted to be thought of as a real teacher. The environment was created for me. It was meeting my needs. So when you look at the pictures on here on this slide, that beautiful classroom with all the plants and things like that, that's a storybook classroom. But the picture on the other side, that looks like a place I want to go and play and have fun. So you are real teachers, and you should create environments that meet the needs of children. A place where children can move, talk, interact, engage, and you want to have noise, happy noises. When you are standing in your classroom and nobody needs you, that is the goal. You have done the work and you have done your job. Next slide, please. We need to give children an overdose of play after the last 18 months. We need to sing and dance and play games, laugh and interact. I was always grateful for my job as a teacher. I couldn't believe that I actually got paid to play. Play is really the most important part of your job. That is where the magic happens. That is where the music is made. So next slide, please. When making your visuals, don't forget about our Early Learning Resource Center. I have emailed you the information about the ELRC with the handouts. Next slide, please. Building relationships. Begin the year with building trust and relationships. Do not think that how you grew up is how these children are growing up. Know where your students are coming from without bias or judgment. And the home visits is a good place to start with that. Greet your families each day. Be happy. Be excited to see them. Your eyes should light up, just like it says in the quote there. Over communicate with parents. Share the classroom expectations. Share the social skills that will be taught. Problem solving steps, acceptable solutions. Plan parent engagement activities. And don't forget about Ready Rosie. Ready Rosie is all about parent education, and the DCDEE requires you to use it this year. I always tried to plan one activity for each month. Some parent engagement activities were in person at school. Parents were invited to some sort of event or education. Some activities were send home activities where I would send home something for the whole family to participate in. And some activities were just about parent education and sharing resources with those parents. Have a parent bulletin board if possible. Use a whiteboard to share the activities the children participate in each day and add reminders. When I was a teacher, that whiteboard was the most magical thing for the parents and for me, because before that, when I worked for Barium Springs, I had to send home a daily note with each child that said, you know, how their day was, if they ate, that kind of thing. And with that whiteboard, I could just say, this is what we did today. And then when the parent came in, I could add whether they ate or if they slept good or that sort of thing. But that whiteboard was magic. Every parent that I had would read that whiteboard. So have a parent bulletin board if possible. Use the whiteboard. Utilize those distance learning tools that you learned about this past year, and the resources and apps to send pictures, reminders, positive messages, send home notes, post reminders at the entrance of your classroom or the school. Use social media if possible. Now that we know about Zoom, that may help with parents' education, and it may also help with parents that are hard to reach because of work. Next slide, please. This year, really think about those separation anxiety for the parent and for the child. And after the last 18 months, let them know that you care about them and address and try to calm their fears of school. Share resources with families. They may need community resources, and we are here at Smart Start Rowan, and we can help provide some of those resources or find some of those resources for you. We have this family support services, and we offer the Triple P program. That's the positive parenting program. If you see a parent who is just struggling with being a parent, then please reach out to us and we will connect them to these resources. Also, if a family has young children who are not in any sort of program or school or childcare, we have Kaleidoscope Play and Learn. And this is a play group for young children, and it educates parents on child development. Miss Ermelin, who offers these sessions, is amazing, and the parents and the children really love her. Next slide, please. This is the next virtual parent seminar that Ermelin is offering, and it also has her information on there. Next slide, please. Social skills. So model and teach those social skills. Intentionally teach about feelings, and that feelings are okay, and how to recognize feelings in themselves and how to recognize feelings in others. And it is hard to see how someone is feeling if they have to wear that mask. And that is something that you can also teach about eyes and body movements, that when you're happy, this is the way it looks. And when you're sad, this is the way it looks. And teach problem solving and appropriate solutions. calming techniques, and teach those skills to all children, not just the ones who are challenging. Self-regulation is one of the most important skills that you will foster. We can't control how a person feels, but we can teach that every emotion is a message from our bodies, and we just learn how to recognize and calm ourselves if needed. Remember, you are not failing as a teacher or a parent because a child is having emotions. Next slide, please. Have small group activities with 3 to 5 children to foster social cooperation, learning from peers, and building a classroom community. Another important academic skill that is fostered with small groups activities is the plan, do, and review. Making a plan, following through with the plan, and making adjustments along the way if needed, and then talking about the process after it's finished. If you never learn how to play with others, you will never be able to work with others. Next slide, please. When I come out to visit your classroom, and I really do plan to come out and visit your classroom, I really want to see those feelings and solutions and problem-solving visuals posted and referred to when needed. The National Center for Pyramid Model Innovations has so many updated resources for classrooms, teachers, families. If you have the old resources, you may want to go to the site to get updated visuals. These visuals on the screen came from there, and they have really new social stories, and like Tucker the Turtle, he is really cute now. You should go and get those and download them. Next slide, please. This is the link for the Pyramid Model Innovations. Next slide, please. So there are 3 things that I want you to focus on this school year: creating that safe and playful environment, building those relationships with the children and their families, and intentionally teaching those social skills. I really want you to reflect over the last 18 months and decide not to go back to the same in-person teacher that you were in the past. Be grateful for the lessons learned and utilize the skills and the tools that you have acquired, and set new goals for yourself this year, and let me help you with those goals. I can help you with so many things in the NC Pre-K classroom. I can help with your professional goals. I can help with ECHRS, classroom management, challenging behaviors, classroom environment, creative curriculum, teaching strategies, the pyramid model, and so much more. All you have to do is email or call. So now we're going to take questions about anything. Anything you have a question about, we'll try to answer for you.
Carolyn, do you want to explain to everybody what that link is that you just put in the chat?
Sure. The link that I just put in the chat, that is the most current of the revised flexibility. And in there, that was done on, again, March 1st, 2021. And it is talking about how the child health assessment immunizations now need to be within 30 days. But then it does list what some of the flexibilities that we still have in place. So it's a 3-page document.
I just put in the chat box the SurveyMonkey link for your training evaluation. And we do need this completed by everybody who is here.
So, any other questions? Wow. I left a lot of time for you guys to ask questions. Maybe you'll get a little time back today. I don't know.
Their brain is fried. That was,
My brain is fried. It really is. I've been stressed out.
it's just a lot of new information. And I guess going into another school year with potential changes.
Oh, I see in the chat where it said, will you talk briefly about the importance of everyone working together in the classroom? And that is so important. You guys need to work together. You are a team. Your teacher, teacher assistant, even the administrator, floaters, anyone who comes in there. It is very important that you're all on the same page, that you're not putting too much work on just one person, that you're all sharing the workload. Anything else you can add, Jamie? I'm trying to think.
I'm responding to somebody in the chat.
Oh, okay. But it is so important. And teacher assistants are so important. Teachers rely on those teacher assistants so much. And we couldn't do it without you. Nobody does this alone. It's just that everybody needs to work together and make a plan. Talk about your transitions. Talk about going to the bathroom and those routines and what you would like those jobs to be. If you do this and I'll do that, and break up the work for each other. So can
I have a
anybody?
quick question about physicals again. Back in the beginning, you were talking about the vision and hearing section being done on the physical. And we have so many children with special needs where we constantly get unable to complete written on our physicals. How acceptable is that? Is that not acceptable? Do they have to continue to go back? Do they get an extension if, you know, their child with autism is struggling with the hearing test or putting the thing over their eye for the vision test? Is there any flexibility with that?
That is probably Cynthia. Cynthia, do you want to?
I think
Yes.
Carolyn would also,
Yes.
you know, because I think she's the
Licensing.
best to answer that.
Okay.
Is Carolyn still here?
Yeah.
Okay, Carolyn, do you want to address it?
We lost Carolyn, I think.
Is she still online?
She was, because we require hearing and vision, but it's more about licensing. And it's more that I know that licensing will mark it as a violation if they go to your site. So
Yeah, that's
that
what
would be,
we've been told, right, Cynthia? We've been told, you know, some licensing consultants give more grace than others have. I don't know what Carolyn's take is. We're told by the state that it needs to be completed. It can't be the child was uncooperative. Now, I've argued this point over and over, and they know we cannot force children to do things. We can't force adults to do things. And so that's the answer that we're given. It does say in the guidelines now that you should document that. I think, you know, I get guidelines from year to year mixed up and I don't have them in front of me, but I believe it says something like make documentation of your attempts, you know, like the letter that you provided to families that said, you know, this is a reminder, your child needs to have a vision and hearing screening or something like that, so that you're showing due diligence that you tried to get the family to complete this. I know with children with special needs, it's, you know, it's a different issue other than just a family that has chosen not, you know, not to do that part. But it's really kind of licensing.
Okay, so what I'm hearing, and make sure that I'm right. So what I'm hearing is that it's at 30 days, if it's incomplete, we're not supposed to continue to allow them in care, from my understanding of the rule. The normal,
that's
like,
not.
not
Yeah,
for NC pre-K. So I guess my concern then just becomes like, even though we have all the documentation and we're trying and it still doesn't happen, we're, still being hit with the violation on it. So is it just one of those things that we're just gonna get hit with it?
Yeah, it's our understanding, Heather, that, from NC pre-K standards, when I talk to our state, our state program
Consultant.
person, for NC pre-K, they don't want you to kick out children because you don't have it. But they won't put it in writing in the guidelines that say that it's okay for you not to have it. And so that's why I say it's kind of whatever the licensing consultant decides to do. And that's why what we've always said to you all is that, I'm not going to tell you that you need to take a hit at your facility. It's going to be your choice. I'm just going to say, these are the guidelines and this is what the state has told us. And we don't want you to drop a child.
Of course,
But
these kids don't need us to drop them because of a vision or a hearing, correct?
Right, absolutely.
Laura,
So,
Laura, Heather, hey,
Uh-huh.
I'm back. I got my call.
Thank you. Thank you.
So Heather,
Yes,
when
ma'am.
we go in and if a child does not have that vision or a hearing, we would cite a violation normally. I have never come across where I've cited it as a violation and families have been able to get it done within the 2-week timeline. And then the director is able to submit that compliance letter to me. But I will double check and I will talk to my supervisor to see if there is any other flexibilities in that. And I've never had experience where I've had to take it further than that.
Mhm.
So I'll double check. And I think I heard Laura say something about documentation. So making sure that you have documentation, not just from the parent, but from the doctor as well.
And I think that part of that problem is the language that's used. That it's just they were unable to do it or
Obtain, it's like unable to obtain.
Yeah,
And
and
I
there's
think that's
nothing else on there that, it's just saying unable to get it and no reasoning why. So
Right.
I would say if you run into that and if there's an actual doctor's note explaining as to why it was not done, that could be a flexibility, but I will double check on that just to be sure. And I'll make sure to send that Jamie's way so she can make sure to get it out to everybody.
All right. Thank you all so much.
Thank you, Carolyn. Good question, Heather.
yes,
Mhm.
it was, yeah. Because I wondered about that myself, about what to do, because it's like you said, we can't make them do it.
So we do have a couple questions in the chat. First question was, are parents going or families going to be allowed back in the building this year? Carolyn or Teresa, you can answer that.
The guidelines and the guidance is the same as it was the last time. With a parent dropping off a child, the therapist or whoever that is necessary, people working with IEPs or IFSBs, regulatory, and like myself. And it is recommended that you limit non-essential visitors, volunteers, and activities involving external groups or organizations with people who are not fully vaccinated. It's the language in the guidance. So it's kind of still a little bit of a lockdown at this point.
Our next question is the required number of documentation per week the same as the year before, 2 per week for each child? And also, what are the checkpoint dates?
Oh, and the state is the one that's going to make those checkpoint dates for you. Since we are under their license, they are going to be making the dates, and they're also working with teaching strategies on getting that documentation to the kindergarten teachers. But yes, it's still 2 notes per week. And I know that, that is just kind of a guideline, and because there are times when you will not be able to get 2 notes per child per week. And what I look at is I'm not looking at overall like one child. I'm looking at overall how many pieces of documentation. And since the state is going to be sending that documentation into the kindergarten teachers, I would do my best to get as much documentation and make it really clear where that child is and how they are developing. So.
That's it so far for questions in the chat. For any of you that are watching with someone else on their computer, I am going to send this link to Kathy. And when she does the follow-up email, she'll just send the evaluation with that. Just make sure you do it because we do need the evaluation filled out. But you'll all get it in your individual email. You don't have to do it again if you've already done it. You only have to do it one time. So if you've already done it and it's in that follow-up email, just ignore it. It's only for people that have not completed it yet.
And Jamie, did we ask everyone to type their name in the box if they're here? Since it's a requirement that people attend, we need to make sure that we've got an account for everybody, maybe do a screenshot of the names and that sort of stuff.
We did, and I
Okay,
saved the chat, so we have that.
Okay, perfect. Thank you, Jamie.
And then we have one more question. Can there be more clarification on how it would look for the class size and in-person education?
How it will look for the class size and info.
So maybe clarify your question. That was Shanae.
Shanae,
Shanae.
I'm trying to think of how many she has. She has 18, doesn't she? That is in the classroom. We are going back to normal in-person instruction with all the kids present and accounted for. And unless we get some other guidance from DCDE, that's the way it will be all year. And the only exception to that would be if there was a COVID cluster, or if you had to close for COVID, or if there is a child who is sick and needs to quarantine. That's the only time we're going to offer any kind of remote instruction. Hybrid would be, it would have to come from DCDE to limit the class size. Did that answer? I hope.
It sounded like it did to me.
Okay.
She said yes, they answered her question.
Okay. Yeah, we're trying to go back to as normal as possible, I think, and that's what everybody is hoping for. So until they tell us different, that's what we're going to do. Any other questions? I think that
I don't see any more.
Okay, well, that's all I have. Laura, did you have anything else? Cynthia, anybody?
No, I'm good. Thanks, Kathy.
Yeah.
I'm good too, Kathy.
Okay, so I think we're all done then. We can go. Thank you guys so much for being here and for listening to me.
Laura?
Yes. Uh-huh.
I'm sorry. I sent over a teacher change form.
Okay.
So what's the turnaround time for that? The teacher has already been in the system before, so just.
So right now, the statewide system is closed. This system isn't going to open, I think we heard, until the 16th. They're aware that our sites start on the 11th.
Right.
So I can't do any kind of approvals or anything like that right now. So I have, of course, requested that that they work with us to get ours approved right away. So if she has, the right credentials, then it shouldn't be an issue. It'd only be a problem if we found out that, she didn't have the right credentials. So,
Okay,
okay,
thank you.
you're welcome.
I think that they're not opening up that until August 9th. And then we have classrooms starting on the 11th. So it's going to be really quick. Trying to get
I think they said yesterday, Kathy, that it was even later than, or I saw an email or something about it. So yeah, we'll see. We'll work on it as soon as somehow we'll figure it out, fit it in there.
So we have one more question and it says, when is the children's first day back?
That's determined by the site. So we follow the Rowan Salisbury school system calendar. I am getting a lot of families that are saying that they haven't heard from you guys yet. So everyone has gotten their rosters, for a while now. So make sure you're contacting families, at least to let them know that, you're working on it. When they call me, that's what I say, the sites are getting everything figured out. So the individual sites, you can, you need to account for any open house or home visit dates, but you got to make sure that you get those correct number of days of attendance in and go from there. I will be sending out the, in the past, you've given me updates on who the teachers are, that sort of stuff. I just haven't had time to do it, but I will get that out to you. And I think Kathy or Cynthia sent the calendar for you all to update what your school schedule should be.
Yes,
Right.
and also right now, the only two sites that they have an exception for not following the Rowan Salisbury school system calendar are McKnight and Rowan County Head Starts. Everybody else should follow the school system calendar, which the first day is the 11th. And also remember that for home visits, open house, staggered entry, all of that, you have up to 5 days, no more than 5 days.
And the guidance from that we got at the meeting yesterday was that everybody has to start by September the 7th. So that is everybody. Next slide, please. There. Oh no, next slide. That's all everybody's information if you need to get a hold of any of us. But yeah, that's what they had said. That's what their guidance was, that everybody should start no later than September 7th. And they were giving you days before that to do the virtual home visits and open house and that sort of thing.
And that's really, Kathy, because our school system starts early. So ours, our folks definitely.
Yeah, the 11th.
Yeah. Yeah.
The 11th. Yeah, we have to have an exception, don't we, or something?
Yes, it was before the NC Pre-K committee meeting. So the only two that have that is, like I said, McKnight and Salisbury Rowan Community Action Agency. Everybody else should start with the Rowan Salisbury school system calendar.
Okay, well, thanks everybody. If you need us, just reach out to us. I'll be talking to all the teachers and teacher assistants very soon. So be expecting a call or maybe even a visit. We're going to see how that works out.